skin abscess is an infected lump within the skin that usually contains pus, and it's usually sore. Skin abscesses are usually caused by a bacterial infection. We all have bacteria on our skin, but sometimes due to a break in the skin or perhaps a hair follicle, the bacteria travels a little bit deeper and causes an infection. Many types of healthcare professionals are able to treat skin abscesses. These include nurses, doctors, paramedics, pharmacists, and physicians' associates. Some abscesses will require treatment with antibiotics. However, it's important that antibiotics are only used when absolutely necessary. Some small abscesses will drain spontaneously and will not require formal treatment. Others will worsen and will require the assessment of a healthcare professional. The bacteria contained within skin abscesses can spread and cause infections in other parts of the body. They can also spread to other people and cause problems. Good hygiene measures are really important in order to prevent that spread. Yes, skin abscesses can show up on any part of the body where there's skin. Often skin abscesses are painful. It depends a bit where they are and how big they are. It's common for the skin abscess to start off hard and then get more soft and raised. If you're worried about it, we would always advise speaking to a healthcare professional. Yes, skin abscesses can burst. In fact, sometimes the measures that are suggested by the treating healthcare professional actively encourage the abscess to drain. Sometimes though, when it bursts, particularly when they burst on their own, the infection can spread, you can become unwell, and the redness can increase in size. In those cases, we would often suggest seeking a conversation with your healthcare professional. Yes, often skin abscesses can be treated at home, but only when they're small, when they don't last very long, and when you're not unwell with it. Sometimes it can be difficult to tell the difference. Generally, skin abscesses are larger, deeper, more painful, and can contain pus. We would generally suggest talking to a healthcare professional when the skin abscess is getting larger, is spreading, if you're unwell in yourself, if you've had it more than 2 weeks, or if it's a recurrent abscess. Yes, in rare situations, a skin abscess can lead to sepsis. If you're worried about this, or if you're unwell in yourself, our advice would always be to speak to a healthcare professional. It's maybe unusual for a medical condition to cause a skin abscess, but there are a number of conditions which make skin abscesses more common. Yes, some skin abscesses will come back. In those cases, we would usually advise talking to a healthcare professional. No, a skin abscess is not caused by allergies, it is an infection. The usual advice would be to speak to a healthcare professional if the skin abscess has not gone after about 2 weeks. Our advice in that situation would be to keep it clean, to keep a close eye on the area and make sure that it settles down over the next few days. If you're worried about the size of a skin abscess or that it is increasing in size, our advice would usually be to talk to a healthcare professional. Usually skin abscesses do not need to be removed. However, sometimes your healthcare professional might suggest that removal is the right thing to do. This is usually because of where the skin abscess is or because it's become a recurrent problem. Good hygiene measures are important, but do be careful when cleaning around the skin abscess. There's a large amount of information available online about skin abscesses. We'll put some resources on screen now.